Well, I'm Dr. Parthajit Das, consultant rheumatologist working in Apollo Hospital, Calcutta. This is a great honor to interview one of the doyens in rheumatology, Dr. Malaviya, sir. Sir, if you allow me to ask you a few questions.
Certainly, Dr. Das, it's a pleasure
Okay.
to be here with you.
Right, sir. So, what do you think, rheumatology as a evolving subject? How do you think rheumatology has evolved over the last 4 or 5 decades?
I came back from USA in 1968 at All India Institute of Medical Sciences. At that time, rheumatology was only known as rheumatic fever and mostly handled by cardiologists. From that till now, more than 1,000 attendees of the Rheumatology Association meeting, it has really grown. And if I tell you something about the satisfaction level of physicians in different specialities, it is so interesting to learn that if you really want mental satisfaction and academic satisfaction, the studies tell that rheumatology is probably one of the most satisfying fields among all the fields of internal medicine. Now, this is probably due to the availability of increasingly effective treatments. But before that, even diagnostic challenge, which used to be so difficult in the past, has become now much easier. The physicians can diagnose these diseases much earlier, assess them in a better scientific way, and with the increasing availability of the drugs for treating different aspects of these diseases, the treatment of the patient has become most satisfying. And this is why, if you take the statistics of how many postgraduates are choosing which field to super specialize, it used to be, as usual, cardiology, gastroenterology, main, and neurology. And now, in the last 2 years, I'm told the largest number of persons who want to take up this specialty, super specialty, is rheumatology, which means that it has really grown well. People have realized the importance of this subspecialty of medicine. They also know that here the patient satisfaction and the satisfaction of the treating doctor is very high, and therefore the growth of this field is really fast and extremely satisfying.
Thank you, sir. So we are in IRACON 2023. So how do you think, what are your thoughts about the program in this scientific conference?
As I can see over the years, from simple case presentations, it evolved into series of cases presentation. Then it started including multi-centric studies, as in the present conference you have seen several major institutions of India have collaborated to give bigger numbers, and the observations are becoming more and more scientific and more evidence-based. And I think the next step is going to be more molecular level research, because one of the things which I'm very fond of telling, what we see clinically looks like a single disease. Take lupus or rheumatoid or dermatomyositis or Sjogren. They look like a similar disease, but when you go at the cellular level and then go to the molecular level, I think we are dealing with a heterogeneous group of conditions which clinically look similar, but not exactly the same. And this might be behind a large number of so-called very promising drugs failing in third phase of drug trial. And one of my papers is coming in the next issue of the Indian Journal of Rheumatology. I call it endotyping. There is one thing like phenotype. You look at the patient, clinically you diagnose it. Then you do genotyping. These are the genes, and that's why this gene is present, so this lupus will have more of kidney disease. This gene is present, so this will be more responsive to this drug. But then you go to endotype, exact physiological pathway which molecules, at what level, which cytokine is abnormal in which group. And this will ultimately going to tell you the phenotype is too superficial. Endotype is going to tell you the precise pathobiology in subgroups of these conditions. And the result is going to be fantastic, because if carefully look at the drug trials, failed drug trials, for example, baricitinib, it failed in lupus. Look at the information very carefully. There were some patients who did respond, but when you take the whole group, it was not effective. But take those who are outliers on the two sides. What was specific in them that they responded to baricitinib? The word being used for those who are outliers, responding but as a group didn't show the response, that's called theratype. This theratype is responsive to baricitinib, but when you take the whole group, baricitinib didn't show the response. That is going to be the future, and I think my fourth generation of rheumatologists who are now developing into great scientists, they are going to tell us endotype, and which endotype, which theratype is going to work there. That is the future. And the way Indian science is increasing, I'm pretty sure that large, bigger studies, and we have the strength of numbers. Westerners have very few and they are doing so much work. We have large numbers of patients. And that will make very soon India as the leading country in science of developing newer therapies for these relatively difficult to treat diseases.
Okay, thank you, sir, for this very insightful answer. Sir, in that way, so what would be your advice for the newer generation of rheumatologists who are coming up?
Oh, I have some very clear, messages for them. Number one, decide whether you will like to be practical, clinical rheumatologist, sit in a hospital or private clinic and cater for those who are ill with rheumatological conditions. Or you decide that besides doing clinical work, you will like to teach and go to a teaching institution where you may do some clinical research as well. But basically, your interest is developing the field of rheumatology and teach that to new generation who is coming to learn rheumatology. That means rheumatology teacher. I consider myself in that category. Then some of the youngsters, you can see immediately they are not much interested in clinical. They may not be the best speakers, but they are so good the moment they go in a laboratory and start dissecting the animal model or start dissecting which cytokine is working there. So I think at a very early stage, our rheumatologists should decide practical clinical rheumatologist for practice, teacher rheumatologist, and I consider myself as one of them. In addition, do some clinical research, but teach. Give them the concept of rheumatology and approach to a patient. Or be a quiet person, sit in a quiet room and do research, basic research at cellular, molecular, and cytokine level to advance the science of rheumatology for future. That's the way I look at it.
I think, thank you, sir. It's always a great learning experience speaking to you. Thank you, sir.
Thank
Thank
you.
you very much.